And welcome back to the Morning Blend with our continuing series, Insurance 101. Well, there's no doubt the COVID-19 pandemic has affected all Americans, but what about those who are 65 years and older on Medicare?
Independent insurance agent Julie Lucy joins us with how your employment affects your insurance during this outbreak. Hey, Julie.
Hey, Julie.
Hi, Molly. Hi, Tiffany. How are you?
Good.
Doing good. Good to see you. Let's talk about people. Let's talk about people who are 65 years and older. This pandemic has affected all of us, but for people 65 and older in particular, how has it affected them?
Well, first of all, I want to say that insurance companies have really stepped up to the plate in helping Medicare patients, even if they don't have COVID or if they do have COVID. Medicare will pay for lab tests associated with COVID-19. They will pay for authorized FDA-approved COVID-19 antibody tests. And I think most importantly, they will pay for medically necessary hospitalizations associated with COVID-19. I just got an email yesterday from a Medicare provider that for just the, Medicare patients, they will pay for a primary care visit. They will pay for behavioral health, and they'll even pay for telehealth. So it's not just the COVID patient, but it's also the Medicare person.
I love hearing that. I think it's important that everybody steps up to the plate during this time. So it's nice to know that people can feel covered and taken care of. There are still, 10,000 people turning 65 every day right now. So with everything going on, are you still able to sign people up for Medicare, and how are you doing that?
Well, unfortunately, this population has been the hardest hit. So we've had to change how we do things, but I think everyone has had to change how they do things. We are changing the way we educate people on Medicare and the way we sign people up for Medicare. We're still doing our Road to Medicare educational classes once a month. They have been very successful and very well, received. What I want to emphasize is that we can do them on the phone or we can do them remotely on the computer. So you can choose the way that you really, want to learn about Medicare. For people that are turning 65 or 3 months before they turn 65, what I can do is email you different Medicare plan options, and I can mail them or I can email them. So there is an option there. And what I can do is educate you on those plans, as well as we can do an application together as well. If you don't have a computer, you really don't need one to be educated or to sign up for Medicare. This is an easy process. I am not that computer literate, and I have learned, and I want to say that it's been very successful for us over the last few months.
That's so good to hear. And we're going to talk a little bit more about those classes you mentioned in just a bit. But I want to talk about unemployment, because we've heard startling numbers. About 32 million people have had to sign up for unemployment. Some of them, of course, are 65 and older and on group health or COBRA perhaps. So what should they be doing?
Well, it's sad. People have been let go. They've been furloughed. They've had their salaries decreased. I have quite a few calls right now from people who are on a group health plan that might now be on COBRA. I think what I want to emphasize first is there are lots of options for you out there. If you're 65 years old and on a group health plan, we can change you right over to a Medicare plan. Medicare probably is a more affordable option for you, and Medicare costs less than 80% of all all group health plans. We can do a comparison to make sure that you're getting the best, whether it's Medicare or it's COBRA. We can do, as I said, a cost analysis to make sure you're getting the best, the best care. People are on COBRA and it's expensive. And if you're 64 years old and on COBRA, what we can do for you is put you on a short-term medical plan. And then when you turn 65, we can switch you right over to Medicare. So these short-term medical plans are great. They provide medical coverage from day 1 through day 364. And I've had a couple people call me regarding this. If I want to emphasize that there's really no charge for any of the services that I provide. As I said, we can do it remotely, we can do it in person, we can use the mail, you don't need a computer. And I just want people that have been let go or downsized, that there are options for you out there. Give me a call and we can discuss your options and either talk remotely or on the phone. And again, I just want to emphasize that this has been successful and easy.
Thank you so much, Julie. I think it's so great. There's a lot of people who definitely heard exactly what you were saying to them. And I think it's a very important message right now. So thanks for joining us. I'm going to give all the information for people to reach you.
Okay, thank you so much.
Thanks, Julie.
Absolutely. And here's the road to Medicare's. They're coming up on Fridays, one in May on the 15th at 10 and one in June, the 12th at 10. These are virtually or by phone, information only, but you do need to reserve a spot. So here's how you can do that. Contact Julie if you've got questions about anything she talked about today or signing up for Medicare or changing your plan at 414-253-3554, or you can email her directly at julie@jlmedicare.com for more.